It's been great. One of the big pleasures about teaching in a global health program is that your students are there because they want to be. So it's not like in a major where you have to do a distribution requirement that requires you take all of, the history of theory or this kind of thing. Global health is by nature interdisciplinary, and I'm a very interdisciplinary person. And so you have students that are interested in being there, but they have other minors. So you get a bunch of people that are, of course, pre-med, but then you get to mix them with people that have double majors in chemistry and English literature, and another person that's doing something on political science and communications, and another person that's in human, what is it? Human science and culture. And they all have very different perspectives, and the students here, many of them are very well traveled, or they have very diverse backgrounds, which means they're always bringing into the classroom little nuggets of, oh, well, when I was in Peru, this happened, and I wonder how we can think about this in terms of that example. And so you have enough teaching material just in the students that are in the classroom to develop an entire class on its own. So it makes teaching here extraordinarily rewarding and fun. This last year is my first year, so I taught the Introduction to International Public Health, which is the required core course for all of the minors. And then I got to develop 5 other courses for the year. So at my first quarter, I taught HIV/AIDS in Africa, which I had taught previously at the University of Florida, but this was the quarter system and a different set of students, so it got tweaked a lot. And then in the winter quarter, I developed a class on qualitative research methods in global health research, which ended up being a tremendously fun class for the students and for me, as well as biomedicine and culture. And then in the spring quarter, I did a class on Indigenous medicine and global health, and another one on hospital cultures. And hospital culture sounds a lot like biomedicine and culture, but they're actually tremendously different classes. One is really looking at why, when you walk into one hospital in the middle of Bangladesh, we recognize it as a hospital, and yet it's so different from walking into the one in Thailand. And so that class is really thinking about institutional cultures and how medicine and infrastructure and administration and policy and economics all play in to the way that healthcare is delivered in hospitals. Global health impacts just about everything. When it comes to trying to think about our own backyards or going abroad someplace, when it comes to health, health is sort of the foundation of being able to build everything else. You can't have a good economic situation if you don't have a healthy populace to do the work. And you can't have a good education if you're not healthy enough to learn. And so there's a lot of ways that things that we think of as sort of the common tracks in terms of, going for a business degree or a law degree or a medical degree. There's a lot of aspects of trying to think about how we can create people that are the most productive in the world that tie into that. If you want to have people that are able to make the world go forward in a variety of different ways, then we're underutilizing our human capacity. And so global health can really start helping people think creatively about how are ways that we can think about improving this situation at home or elsewhere in a way that brings all those talents to the best place that they can be to be able to move forward in creative directions. Right now they say that the careers that our undergraduates are going to have in 5 years don't even exist yet. So I think the more that the students can be taking things that are maybe multidisciplinary and thinking about things simultaneously, not just economics or political science, but how does political science and art fit together in some novel ways? And Northwestern is an amazing place to be able to do that kind of thing.